My name is Mrinal. I worked at the University of Leicester in UK, and I work as a research fellow, and I worked on infectious disease. And I came to know about COVID first from the newspaper or probably through internet. Then there were a lot of people talking in my department because it's a department of respiratory sciences. So there were clinicians, there were scientists who were working with the respiratory disease, and they started talking about this. And initially we thought that it could be any of some common flu kind of things, but yeah, later on it took a momentous turn, I would say. When I first learned that it was a COVID thing, it was a coronavirus, then I thought that it could be like SARS or MERS. Probably it will have some impact locally in some areas, but never thought it's going to be a global pandemic. During initial period, I got a permit to go to work because I had some of my research work pending at the university, and I was also part of the team who were maintaining those animals for which the experiments were going on. So more or less I was going to my office like almost 80% of the time, even during the pandemic. And in fact, I volunteered to do that. Nobody asked me to do that. My research work, it did get impacted because we had to close down the animal facility, and my work was preclinical work, and so we have to like pause our work for some time. But yes, I stopped my original research work. Then I started working on like COVID research. So I learned a lot of new things during this COVID research work, and one of my work was how the T cell response is different between different ethnic population, and how the humoral response is different, how the T cell response is different, and we did learn a lot from this like COVID research. University of Leicester, the research impact wise in the clinical medicine, it's the second in the UK, and it's mainly because of that the interaction between the clinicians and the researchers in that, and that really, like the group, I would say that it expanded dramatically during this COVID period. So there were groups from diabetes, there are groups from respiratory disease, there are groups from the social scientists who deals with the ethnic differences and all. Like my wife, I would say, like she is a social scientist. She was working with environmental issues, but now she is a full-time health ethnic researcher, like, and because of COVID, I think her career has shifted from an environmental scientist to a health social scientist.